One of the most common sleep disorders is narcolepsy and is characterized by extreme daytime sleepiness and difficulty staying awake during the day. According to WebMD, narcolepsy is a neurological disorder that alters your ability to sleep and wake. Narcolepsy disrupts daily life and can cause serious physical and mental problems. The symptoms of narcolepsy vary from person to person, but most people experience excessive daytime sleepiness and hallucinations. In addition to being unable to stay awake during the day, many people with narcolepsy also experience sleep paralysis or cataplexy, an overwhelming feeling of being paralyzed while asleep or awake. Sadly, narcolepsy is one of those disorders that have no cure. Having said that, through lifestyle changes and some other things, you can effectively manage it. Before we get to that, it's imperative you understand its causes, symptoms, types, as that will help you manage it better. Symptoms of narcolepsy. According to Healthline, narcolepsy has 7 common symptoms. 1. Excessive daytime sleepiness. Excessive daytime sleepiness is characterized by uncontrollable episodes of sleep. When you're struggling with excessive daytime sleepiness, you might find yourself nodding off at work or in social situations, even when you're sitting awake at your desk or having conversations with friends and colleagues. Each episode of sleep could last for a few minutes up to half hour. You wake up feeling refreshed, but you eventually get sleepy again. Excessive daytime sleepiness is perhaps the most troubling aspect of narcolepsy. People who don't know often think of narcolepsy patients as just lazy when they sleep excessively at work. Excessive daytime sleepiness is often the earliest symptom of narcolepsy. 2. Sleep paralysis. Sleep paralysis is a condition in which a person finds themselves temporarily paralyzed, unable to move or make any noise while asleep or upon waking up. Sleep paralysis is another common symptom of narcolepsy, and each episode could last from a few seconds to a few minutes. Most people who experience sleep paralysis while conscious find it terrifying and usually have no problem recalling it. If this sounds scary, remember that during REM, some of the body's muscles are also temporarily paralyzed. Sleep paralysis doesn't automatically mean you have narcolepsy. Many people experience sleep paralysis without having narcolepsy. 3. Changes in the REM, rapid eye movement. Rapid eye movement sleep is the stage of sleep characterized by rapid and rhythmic brain activity. It's also called REM sleep for its typical rapid eye movements during this stage. This type of sleep is important because it plays a role in memory consolidation, especially for long-term memories. Typically, REM starts around 90 minutes after falling asleep. But for people with narcolepsy, it can happen after about 15 minutes of falling asleep, whether day or night. 4. Hallucinations. Hallucinations are delusions that can occur at any time to someone with narcolepsy and are usually vivid and scary. They're visual, more often than not, but other senses can also be involved. They are called hypnopompic hallucinations if they happen upon waking, and hypnagogic hallucinations if they happen as you are falling asleep. 5. Cataplexy. Cataplexy is a symptom of narcolepsy in which a person experiences sudden, brief, and uncontrollable episode of loss of muscle tone while awake. When it happens, it can result in slurred speech, weakness, or complete inability to move most muscles. These symptoms may last up to a few minutes. It typically occurs when people experience intense emotions, such as laughter or excitement. However, sometimes it occurs when fear, surprise, or anger strike. Although not everyone with narcolepsy experiences cataplexy, there are some that experience many episodes every day. 6. Automatic behaviors. People with narcolepsy can sometimes continue with actions like eating or driving for a few seconds to a minute without realizing it. 7. Fragmented sleep. A person with narcolepsy may have trouble falling asleep at night regardless of the excessive daytime sleep. That's why part of managing it includes good sleep hygiene. Enjoying the video? Don't forget to subscribe to our channel for more helpful videos like this and give this video a thumbs up. We will appreciate it more than you think. Types of narcolepsy. Narcolepsy is divided into Types 1 narcolepsy and Type 2 narcolepsy. Type 1 narcolepsy, it happens due to low levels of an important neurochemical that regulate REM sleep and wakefulness called hypocretin. It's also known as narcolepsy with cataplexy. Type 2 narcolepsy, on the other hand, People with type 2 narcolepsy have normal levels of hypocretin and do not experience cataplexy. Causes of narcolepsy. Scientists have linked narcolepsy with a lack of hypocretin in the brain. Hypocretin deficiency causes excessive sleepiness and changes in the REM sleep cycle. Scientists also think that factors like family history, environmental toxins, brain injury or tumor, infections, and autoimmune disorders play a role in narcolepsy. Narcolepsy-related conditions. Sleep apnea. Sleep apnea is a sleep disorder that interrupts breathing during sleep. It causes a person to wake up gasping for air. Periodic limb movement disorder, PLMD. This is a neurological condition that makes someone's limbs twitch involuntarily, such as hands. Management and treatment of narcolepsy. Lifestyle changes that can help. 1. Have a consistent sleep schedule by going to bed and waking up at the same time every day. 2. Exercise for a minimum of 30 minutes every day, but make sure it's at least 3 hours before bedtime. 3. Avoid screen exposure from TV, tablets and phones hours before your bedtime. 4. Avoid caffeine intake 4 to 6 hours before your bedtime. 5. Avoid alcohol 4 to 6 hours before your bedtime. 6. Take power naps, 20 to 30 minutes, when you are most sleepy, if possible. 7. Manage your stress before going to bed. 8. Create a healthy eating habit. 9. Listen to some soothing music. 10. Create a proper sleep environment by making your room dark, cool, and having a comfortable mattress, pillow, and bed sheets. 11. Take a hot bath before bed. It's worth noting that most experts recommend lifestyle changes as the best way to manage narcolepsy. Stimulants. Stimulants are prescribed to people with narcolepsy to improve wakefulness. For example, modafinil is a stimulant that was developed as an anti-narcolepsy drug. This drug can be taken by patients with narcolepsy to help them stay awake during the day, but still experience sleep attacks at night. Modafinil also appears to reduce the severity of the disease in some patients. Other stimulants that are prescribed include armodafinil, methylphenidate. Unfortunately, they come with side effects such as headache, anxiety, nausea, and palpitations. Antidepressants. Antidepressants such as selective serotonin reuptake inhibitors and tricyclic antidepressants are commonly used to treat disrupted nighttime sleep, hallucinations, and cataplexy. Examples of selective serotonin reuptake inhibitors include atomoxetine and sertraline, while examples of tricyclic antidepressants include clomipramine and dizipramine. Wake-promoting medications. Wake-promoting medications are prescription drugs that are meant to help narcoleptic patients stay awake during the day. These drugs typically work by increasing the levels of a neurotransmitter called hypocretin in the brain, making it easier for patients to stay awake, but they do not cure-treat cataplexy. Some of their examples include the modafinil we mentioned before and armodafinil. Sodium oxybate. Sodium oxybate is an FDA-approved medicine used to treat cataplexy and daytime sleepiness. It is also known as GHB or gamma-hydroxybutyrate. The drug works by stimulating a neurotransmitter called GABA, which suppresses neuronal activity in the brain. Sodium oxybate can help people with narcolepsy to fall asleep faster and stay asleep for longer periods. Make sure to contact your doctor before taking any medicine to treat narcolepsy. Diagnosing narcolepsy. Don't panic if you are experiencing excessive daytime sleepiness, because many other health problems can look similar to narcolepsy. Instead, go to your doctor for a diagnosis. Narcolepsy diagnosis often involves medical history and physical exam. Sleep record. You might be required to keep track of your sleeping pattern and symptoms for a few weeks. Polysomnogram, PSG. This test is done in a sleep disorder clinic overnight to record problems with your sleep cycle. It determines important things like whether your REM deviates from a normal REM cycle. Multiple sleep latency tests, MSLT, like polysomnogram. This is also conducted at a specialist clinic or lab. The test is performed during the day to find out your likelihood to fall asleep and whether REM cycles happen at unusual times. When to talk to your doctor. If you are experiencing excessive daytime sleepiness and it is disrupting your personal or professional life, see your doctor. Thanks for watching, and make sure to subscribe to our channel for more awesome videos like this, and give this video a thumbs up, it would mean the world to us. Also, check out this video on worst foods to have before bed.